Wastewater may help health officials understand the growing opioid problem.
You may remember hearing about BioBot. It was used during the pandemic to track COVID-19 through fecal matter. Now that same technology can track illegal substances. Local 3's Jeremiah Beatty has the story.
When you flush your toilet, you could be saving lives. The accuracy of this testing, experts tell me, is pretty impressive. These wastewater samples can determine intervention methods or spot trends. BioBot epidemiologist Alex Bubin says this type of study is on the forefront of our understanding of drug use. And if you're wondering whether the experts have gone crazy,
it is unconventional, but very much needed.
Bubin says it provides health officials with data on the types and amounts of substances people are using in addition to other drugs. They can track everything from fentanyl, methamphetamines, cocaine, nicotine, and very soon xylazine. The DEA lists xylazine as one of the deadliest drugs in addition to fentanyl.
It is simply just a matter of being able to give a 10,000-foot overview of a community to say whether use is increasing, decreasing, staying the same.
BioBot is the first company to cut a path to public health surveillance. It was founded in 2017 to help epidemiologists track surging COVID-19 numbers in wastewater. Bubin says the concept is similar, but instead will be used to find opioids. At first, some may think it's an invasion of privacy. Bubin says BioBot doesn't publish sample information, only public health agencies use it. This means health experts won't have to wait for things to escalate.
Essentially, what is happening is that we are waiting for people to overdose or potentially die before we are getting a picture of what is actually happening to cause those overdose deaths.
The evidence lies in fecal matter, and it all starts with the flush.
So we know that when someone consumes a particular substance in their urine, if they use a toilet that is connected to that wastewater treatment system, they excrete what we call metabolites. That basically just says that this substance was consumed by the human body and excreted, and we then collect that at the wastewater treatment plant.
Public health officials can use collected samples to identify communities with high levels of opioids and intervene. Some wastewater treatment plants serve thousands and others millions of people. So tracing back to the initial flush is hard to do.
That's really the beauty of wastewater epidemiology is it's not tracked back to specific people or specific homes or anything. It's just what's overall in the wastewater.
Michael Harris with the Newcastle Sanitation Facility in Delaware was the first wastewater treatment plant to partner with BioBot during the pandemic. He says the initiative works. In places like Cary, North Carolina, opioid overdose deaths decreased by 40%.
We hope it saves lives. I mean, that's the whole goal of this whole program. We're excited for the potential wastewater epidemiology to be used for other things to help human lives and well-being.
And this program is gaining traction.
We work really closely with a lot of our partner communities to make sure that data are being distributed in ways that, again, don't identify individuals, don't result especially in punitive actions, which is a big one for us that we have a very hard line on that we will not do.
Bubin says because BioBot is able to work with anonymity, it can even help experts understand the stigmas associated with opioids.
Because we've really seen it demonstrated that it's not just isolated to the areas where people think it happens. It really is a widespread issue that has the potential to spin even more out of control if we don't recognize this as a sort of widespread public health issue.
A ray of hope against a deadly drug that has taken countless lives. Reporting for Local 3 News, I'm Jeremiah Beatty.